Hi everyone, I am Dr. Raghav Malik, consultant, cataract and refractive surgical sciences at Center for Sight. So we get this question a lot, whether artificial intelligence and machine learning are being used in ophthalmology or not. Yes, it is being used, especially in refractive surgery. So refractive surgery, as you know, is the art of getting your spectacles removed. There are multiple ways with which we can remove your power. One of them being LASIK, the other being KLX procedures wherein a lenticule is made and removed from the cornea of your eyes. The ultimate goal is to flatten your cornea and to remove the power. So yes, artificial intelligence is being used now, and it is being used to such an extent that we can, before the surgery, actually predict how your vision is going to be after the procedure. I'll give you one such example. So we at Center for Sight have the latest Schwind Amaris 1050 laser machine, and with that we have a top-up known as FORSIGHT. FORSIGHT, as the name suggests, you can look into the future. That is exactly what artificial intelligence is doing. So basically with this FORSIGHT software, you can actually see what the result of your refractive surgery is going to be. So just imagine you go to your ophthalmologist and he tells you that yes, after we do your tests, I can give you a rough estimate or a rough idea how you are going to see before the surgery. Till now, we did not have the option. Till now, we were only telling our patients that yes, you will be 6x6, 6x5, whatever. So we could not give them a rough estimate or an idea how they are going to actually be seeing after the procedure. So now with the FORSIGHT and the Schwind Amaris 1050, we can actually look into the future and give our patients a rough estimate how they are going to see. Just imagine you go and let's say you are on the road, you're driving, you like a car. You want to buy the car. What's your first step? You go to the dealership, you ask for a test drive. So you can see what the features are, how the car is running, what is the mileage, what is the color, multiple options you see. And only then you decide if you want to buy a car. You never go to the dealership and just buy the car. You do a test drive first. Similarly, so artificial intelligence in refractive surgery is equivalent to doing a test drive to your refractive surgery. You can actually do a test drive and see how your vision is going to be after the surgery. Similarly, there are many more features where artificial intelligence is actually being used. So basically, there are some tests which we have to do with which we can know whether the patient is fit for the surgery or not. We can use artificial intelligence and apply those algorithms to the tests and know whether the patient is going to be fit or not, so that the chance of you having complications later in life decreases to a very low percentage. It makes the surgery very, very safe, very secure, and both you and the surgeon are very confident in going ahead with the surgery. Also, AI is now being used with the Schwind Amaris to do a surgery known as Presbyomax, wherein we can give our patients who are above the age of 40 years, who have a power for distance as well as near, they can get the power removed. So with a very modern software, both your powers for distance as well as near can be removed, and patients get a very, very good lifestyle even after the age of 40. A lot of people come to us and are very dejected that we could not come to you when you were 20, 25, now we are about 40, now what do we do? Are there any options? Yes, there are. We have the Presbyomax, there are other lens-based procedures also with which we can remove both your power for distance as well as near, and you can lead a spectacle-free life.
Follow Planet LASIK and post your queries to get answers from the experts.